of Pharmacology for Health Professions, Ninth Edition. We'll be discussing Chapter 15, Urinary System Drugs. Upon completion of this chapter, you should be able to understand the four types of diuretics in terms of uses, side effects, cautions, and contraindications, along with their interactions, and be able to give examples of each. Identify and describe medications given for acute and chronic gout. That includes their side effects, cautions, and contraindications, along with their interactions. Be able to explain the role of certain antispasmodics used to reduce contractions of the urinary bladder. Identify the action, uses, side effects, and cautions and contraindications for urinary analgesics to treat pain and
cholinergic
agents to stimulate bladder contraction. And your last is describe the three different treatments for benign prostatic hyperplasia. Okay, we're going to begin with our diuretics. Diuretics are the most commonly used drugs that influence the function of the urinary tract and increase urine excretion. Their main indication is to reduce the circulating fluid volume to help treat edema and hypertension. Diuretics are divided into four categories according to their action. You have thiazides, your loop diuretics, potassium-sparing diuretics, and your osmotic agents. Alright, we're going to take a look at thiazides, which are the most frequently used type of diuretic, increasing the excretion of water, sodium, chloride, and potassium. An example of that medication would be hydrochlorothiazide, which is commonly said as HCTZ. The uses can include to help with edema, hypertension, and it is also prophylaxis of calculus. Side effects can be hypokalemia, muscle weakness or spasm, posterior hypertension, which means that when you're moving positions, your blood pressure drops, vertigo, headache, and skin conditions, including it could be rash, and you can have photosensitivity. Your cautions and contraindications can include diabetes. You can have a history of gout, severe renal disease, impaired liver function, and greater sensitivity to thiazides will happen and can happen in older patients. Your interactions can include your non-steroid anti-inflammatory agents, your NSAIDs, corticosteroids, lithium, hypertensive agents, dioxazine, anti-diabetic agents, and probenecid. Now, we also want to make sure that we take a look at our patient education, how we're going to educate our patients. If you'll read at the bottom, it has quite a few things, but for medication with thiazides, one of the things that you need to do is make sure that you administer with it food to reduce any gastric irritation. But make sure you read the patient education box. Next up is our loop diuretic, which acts directly on the loop of Henle in the kidney to inhibit sodium and chloride reabsorption, which in turn inhibits water reabsorption back into the bloodstream, leading to increased urine formation. Examples of the medication are furosemide, fumetinide, and torsemide. These medications are not thiazides, but act in a way that is similar to help increase the excretion of water, sodium, chloride, and potassium. Their action is more rapid and effective with a greater diuresis. Uses can include edema associated with impaired renal function, heart failure or hepatic disease, pulmonary edema,
ascites,
and hypertension. Side effects can include fluid and electrolyte imbalance with dehydration, circulatory collapse, chest pain, hypokalemia with weakness, hypertension, tendinitis, blurred vision, headache, muscle cramps, mental confusion, and dizziness. Your cautions and contraindications include cirrhosis and other liver disease, kidney impairment, alkalosis and dehydration, history of gout, pregnancy, lactation, diabetes in patients under the age of 18. Your interactions can include your corticosteroids, lithium, hypertension agents, digoxin, indomethacin,
salicylates,
and your anticonvulsant medications. Potassium-sparing diuretics are under conditions in which potassium depletion can be dangerous. They can also counteract to increase glucose and uric acid levels associated with thiazide diuretic therapy.
spironolactone,
Is a diuretic of choice in patients with cirrhosis. It has also been proven or been shown to reduce deaths in patients with severe heart failure. Your examples of medications are
spironolactone,
and your
triamterene,
side effects can include hyperkalemia, dehydration or weakness, GI symptoms, fatigue, lethargy, profound weight loss, hypertension, and your
gynecomastia,
cautions can include renal insufficiency, cirrhosis and other liver disease, and pregnancy and lactation. Interactions can include potassium supplements, angiotensin converting enzyme inhibitors, angiotensin receptor blockers,
salicylates,
and your NSAIDs. Also, make sure to pay attention to your patient education because these are some of the things that you would need to tell your patients when you are when the provider has prescribed them some medications. Now we're going to take a look at the osmotic agents, which are frequently used to reduce intracranial or intraocular pressure. These are mostly used in emergency situations that involve cranial or spinal trauma and are used to reduce the risk of nervous system damage from swelling. Your example of this medication is
mannitol,
your side effects can include fluid and electrolyte imbalance, headache, nausea and vomiting, hypertension, hypotension, allergic reactions, and a severe pulmonary edema. We need to have extreme caution if it's indicated for kidney and heart failure, severe pulmonary edema, pregnancy, and lactation. We also need to make sure that we read the patient education because that's something that we are going to have to share with our patients, educate them. All right, so what we're looking at is a diagram of how and where the diuretics work. So we're looking at the first one. It says potassium sparing mechanism of action. Its job is to bind to sodium potassium ATP as or PAS transporters, which interfere with sodium potassium exchange in multiple places, where like in your kidney, but it works primarily in the collecting duct. This causes an increase in sodium excretion while decreasing potassium excretion. For example, your medication of
spironolactone.
Okay. Now we're going to take a look at your loop diuretics mechanism of action. They bind to chloride channel receptors in the ascending limb of the loop of Henle, inhibiting the reabsorption of sodium chloride. This inhibits water reabsorption by the collecting tubes by increasing hypertonicity, and that medication is something like furosemide. Now, your thiazide mechanism of action increases salt, which is electrolyte and water excretion, by inhibiting mechanism for sodium and chloride transport in the distal convoluted tubule. This inhibits water reabsorption by the collecting tubules by increasing hypertonicity, and that is hydrochlorothiazide, which is your HCTZ. If you look and follow the channel where it talks about it, you can see the medication, where its job and where it works. Check your knowledge activity. A contraindication for the use of the loop diuretic furosemide is, look at your choices, write down your answers, and at the end of the video you can check your answers. Alright, now we're going to talk about gout. Gout is a metabolic disorder characterized by the accumulation of uric acid crystals in various joints, tissues, and sometimes the kidneys, with resultant inflammation and pain. Most commonly, gout will occur in the big toe, ankle, knee, and elbow. Some of your medications are naproxen, indomethacin, and ibuprofen for pain. Colchicine is not an analgesic and does not affect uric acid clearance. It is used to relieve inflammation in acute gouty arthritis. It must be given within 24 hours of the onset of symptoms for maximum effectiveness and in the chronic management of gout. Colchicine can also be used prophylactically at low doses to prevent recurrent attacks. Your side effects can include rash, alopecia, nausea, vomiting, diarrhea, and blood disorder, and bone marrow suppression. Make sure that we know how to educate our patients about this medication. Make sure to read it. Acute gout is characterized by the sudden onset of pain, redness, warmth, warm to touch, and swelling in the affected joints. It occurs commonly at night and in patients who are not well hydrated. Staying hydrated and avoiding or limiting fruit juices, seafood, red meats, and foods that are high in sugar and salt are dietary measures that help to reduce the risk of acute gout attacks. What you're looking at, if you'll look at the big toe, you see the little balls there that's inside the redness. That is your uric acid crystals. That's exactly how it looks, or how it is for a patient. Uricosuritic agents such as probenecid act on the kidneys by blocking reabsorptions and thereby promoting urinary excretion of the uric acid. Uses can include treatment of chronic cases of gout and frequent disabling attacks of the gouty arthritis. Probenecid is sometimes given with penicillin to potentiate the level of the antibiotics in the blood. For example, with amoxicillin for some gonococcal infections. Probenecid is also given with sulfoxetine to treat acute pelvic inflammatory disease. Your side effects are rare, but they can include your headaches, nausea and vomiting, kidney stones, and renal colic if they are large volumes of fluid that's not maintained, hypersensitivity reactions, a rash, hypertension, and anaphylaxis. Your cautions and contraindications can include history of urine, kidney stones, history of pelvic ulcer, renal impairment, and hematologic disease. Interactions can include penicillins and cephalosporins, potentiating therapeutic effect of antibiotics, oral hypoglycemics, which can cause hypoglycemia through potentiation, your
Salicylates.
which antagonize uricosuritic actions, and then your NSAIDs. Make sure we also take a look and we read our patient education so we can make sure that our patients are educated about the medications. Xanthine oxidase inhibitors, which is a class of drugs which results in decreased serum and urinary levels of uric acid. If the xanthine oxidase inhibitor therapy is initiated during the acute attack, it can make the attack worse. Your examples of medication is your allopurinol, which is one of the medications to treat chronic gout. Allopurinol is used for the prevention of renal stones in patients with a history of frequent stone formation and prevention of acute hyperuricemia during radiation of certain tumors, or your anti-neoplastic therapy.
Febuxostat.
Is the first new oral agent approved for gout since the early 1960s. It is more potent and has a lower risk of hypersensitivity reactions compared to your allopurinol. However,
Febuxostat.
may have a higher risk of cardiovascular adverse events. Side effects can include your rash, allergic reactions, nausea, vomiting, diarrhea, drowsiness, vertigo. You can also have severe hypersensitivity reactions. However, they are rare, but it is increased in older patients with renal impairment who receive allopurinol and thiazide diuretics in combination. Your cautions or contraindications can include impaired renal function, a history of hypersensitivity reactions, liver disease, pregnancy and lactation. Your interactions can include anti-neoplastic drugs, alcohol, and diuretics. Make sure that we are familiar with on how we can educate our patients about this type of medication. Our next up is the pegylated uric acid specific enzyme. Pegloticase is a newer class of gout treatment that lowers uric acid by causing the oxidation of uric acid to a non-gout causing compound called allotonin. It is secreted through the renal system. It is only reserved for patients who are resistant to any other therapy and is given via IV infusion every 2 weeks. Your side effects are you can have infusion reactions, you can have formation of anti-pegloticase antibodies, rebound of gout flares. Your causes and contraindications can include your G6PD deficiencies. Patients can be at higher risk for the G6PD deficiencies are your Africans or Mediterranean ancestries, and they should be screened before starting, and people that are possibly could be pregnant. Okay, let's check your knowledge. Gout most commonly affects which part of the body? Look at your choices, write down your answers, and we're going to check it at the end of the video. Let's take a look at the case study. A 62-year-old male reports to the emergency room with severe pain in his left foot, particularly his big toe. It is red, warm to touch, and he states he is unable to wear shoes due to the discomfort. Upon examination and review at his labs, the physician finds an elevated uric acid level and diagnoses the patient with what? Look at your choices, write down your answers, and we'll check it at the end of the video. We're going to look at antispasmodics. Overactive bladder is a condition characterized by 2 urinary symptoms, frequency and urgency. Now, we think they are the same, but they're not. So, frequency is defined as having to urinate more than 8 times in a 24-hour period. Urgency is defined as the sudden need to urinate. The treatment of an overactive bladder is the utilization of antispasmodic medications. Antispasmodics help to increase the capacity and decrease the urgency of the urinary bladder. The following are frequently used antispasmodic medications.
Tolterodine.
And the
Oxybutynin.
both are used to decrease bladder tone and suppress bladder contractions in patients with neurogenic bladder, resulting in decreased incontinence. Your side effects of these medications can include drying of all secretions, blurred vision, mental confusion, tachycardia, palpitations, and urinary retention and constipation if the dose is too high. We're going to check your knowledge. Here's the question. When diagnosing an individual with an overactive bladder, urinary frequency is defined by urinating more than how many times within a 24-hour period. Look at your choices, write down your answers, and we'll check it at the end of the video. Cholinergic drugs stimulate parasympathetic nerves to bring about contraction of the urinary bladder in cases of non-obstructive urinary retention. Usually it's post-operatively or postpartum. Example of this medication is
Bothanicol.
side effects can include GI cramping, diarrhea, nausea and vomiting, sweating and salivation, headache, bronchial constriction, slow heart rate or heartbeat or reflex, tachycardia, orthostatic hypertension, and urinary urgency. Cautions and contraindications should include obstruction of the GI or urinary tract, hyperthyroidism, peptic ulcer or IBS, asthma, cardiovascular disease, Parkinsonism, and seizure disorder, as well as pregnancy and lactation. Okay, so now we're going to talk about our oral urinary analgesics, or your local anesthetic for your urinary tract mucosa, which can only be used for a short time to relieve burning, pain, and any discomfort and urgency associated with cystitis, which is also known as a bladder infection. It should not be taken no more than 2 days when used with an antibiotic agent. An example of that medication is
Phenazopyridine.
side effects can include a headache or vertigo and GI disturbances, and can present discoloration of bodily fluids, including orange-red urine, and also can cause discolorations on your contact lenses. Wow. Your cautions and contraindications include impaired kidney functions and the use of
Phenazopyridine.
may interfere with blood glucose measures and urine ketone and protein kidney test. Okay? Okay, so we have an image of our kidneys. So you see your kidneys with the kidney beans, you see the arrow pointing to it. You see your reader, that is red. It shows you that that part right there is infection. You got your bladder, and of course this one's the male because it's got a prostate, and then your urethra. But what that is showing is, if you'll look to the right side of it, you've got bacteria and white blood cells. All right. We also want to make sure that we read the patient education on how we're going to educate our patients about the medication that they're taking, about this particular medication. What are some of the things that can happen? Like I mentioned before about the urine, teardrops. Check your knowledge, which is not a known side effect of
Cholinergic.
drugs. Look at your choices, write down your answer, and we're going to check it at the end of the video. Okay, so we're going to talk about the benign prostatic hyperplasia treatment, which is shortened for BPH. It's the most common benign tumor in men. BPH involves hyperplasia, which is an increase in the number of cells leading to prostate enlargement, which interferes with the urinary flow. The 3 medication categories that help treat the BPH includes your anti-androgens, which work by suppressing prostate growth and associated urinary obstruction and minifications. Your alpha blockers block alpha receptors found in smooth muscle in the bladder, neck, and prostate, causing them to relax and improve the urine flow. Your
Phosphodiesterase
is a PDE inhibitor and is used for the treatment of erectile dysfunction. It was recently approved to treat the signs and symptoms of BPH when taken daily. So what you're looking at, if you'll look to your right, you'll see a normal bladder, and then you see the urethra, and you see the prostate gland. And you see how it has to come through. It's almost like an apple right there. When you look at the enlarged prostate, you see how the apple got bigger, so it makes the urethra smaller, so the urine can barely get there. So what happens is that when they try to go to the bathroom, instead of a constant flow, it's like drip, 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 because it's squeezing trying to get through there. Okay, so we're looking at a table that is that has the categories that we just talked about, the benign prostatic hyperplasia treatment. You see the category, you see the medication names, you see the purpose, and the side effects. I'm going to let you read that and make sure that you understand what each category is, what their purpose is, and what their side effects is. Make sure you understand that. Okay, check your knowledge. Which BPH treatment blocks alpha receptors in the smooth muscle of the bladder, neck, and prostate? Look at your choices and write your answer down. We'll check it at the end. We are at the end of the lecture, so let's take a quick look at self-assessment. Ask yourself these 3 questions. Can you explain the 4 categories of diuretics and their side effects? What are the 3 medication treatment categories of BPH? And can you explain the cause of treatment for gout? There are 2 tables inside of this chapter 15, 15-1 and 15-2. Make sure to look at them. Just get familiar with it. Upcoming, you'll see the answers to check your knowledge and to the case study. Take a minute and review, and let's see how many you got right. Let's see. Thank you.